स्टूडेंट्स, आज हम बात करेंगे हाइपोग्लाइसीमिया ऑफ न्यूबॉर्न के बारे में. What is hypoglycemia of newborn? When blood glucose level is less than 45 milligram per deciliter, that is called hypoglycemia of newborn. Two important things that need to be considered. One is that ki blood glucose level is 10 to 15% less than that of the plasma glucose level. Second is that at the time when a sample is withdrawn for lab investigation for confirmation in order to measure plasma glucose level, if there is a delay in doing the testing, the glucose level will fall by 14 to 18 milligram per deciliter per hour. Now what about the sign and symptoms? Sign and symptoms are of two types. They are primarily because of the low blood glucose level. The low blood glucose level which stimulates the autonomic nervous system, which can lead to hypothermia, which can lead to profuse sweating, right? Which can lead to tachycardia. And second type of symptom is called as the neuroglycopenic symptom. These symptoms are because of the low glucose supply to the brain. The systemic manifestations of the symptoms. So what are those? There can be either letharginess, there can be weak or high pitched cry, there can be severe pallor, cyanosis, their baby can be jittery, there can be seizures, baby can be comatose as well. There is increase in heart rate, there is increase in respiratory rate, there can be apnea, there can be vomiting, and the baby can be restlessness, and there can be poor feeding. Talk about, do we need to screen all the newborns for hypoglycemia? No. The term newborns which are born more than 37 weeks, the weight is more than 2.5 kg, and those who are healthy, they need not to screen for hypoglycemia. So who all need to be screened? One is your large for gestational age babies whose weight is more than 90th centile, right? Then second is your small for gestational age babies whose weight is less than 10 centile. Then infant of diabetic mothers. Then those who are born less than 35 weeks of gestation or whose weight is less than 2. On IV fluids, admitted in NICU, or those who are on parenteral nutrition, right? Those who are admitted in NICU for acute illness like your birth asphyxia, like your sepsis, shock, and other condition, they all need to be screened. Very important. What is the schedule for blood glucose monitoring? Those who are at risk that we have talked earlier, they need to be monitored at 2, 6, 12, 24, 48 hours and 72 hours. If after 72 hours they are off GIR and feeding is established, there is no need of further monitoring. Then parenteral nutrition, it can be done either 6 to 8 hourly when it is less than 72 hours. Then after 72 hours, it can be done 12 hourly. For the sick neonatal, so hypoglycemia is when your blood glucose level is less than 45 milligram per deciliter. अब उसके बाद क्या करना है? There can be two scenarios. One is that कि patient can be asymptomatic, the other is patient is symptomatic. पहले हम बात करेंगे when patient is asymptomatic. When patient is asymptomatic but the blood glucose is less than 20 milligram per deciliter, straightway will give bolus of D10 at the rate of 2 ml per kg over 1 minute and will start GIR at the rate of 6 milligram per kg per minute. If blood glucose in asymptomatic patients is between 20 to 45 milligram per deciliter, will give either breastfeed or express breast milk or formula feed can be given. Measured feed to be given approximately 20 to 30 ml, and then we'll check the blood glucose after 1 hour. After 1 hour, if blood glucose level is more than 45 milligram per deciliter, we'll give feed every 2 hourly and monitor blood glucose every 6 hourly. So hypoglycemia when blood glucose level is less than 45 milligram per deciliter and patient is symptomatic. What you need to do? you have to give bolus of D10 at the rate of 2 ml per kg over 1 minute, and you have to simultaneously start the GIR at the rate of 6 milligram per kg per minute. You need to start. After 30 minutes, you'll again measure the blood glucose level. If the blood glucose level is still less than 45 milligram per deciliter, you'll continue increasing GIR at the rate of 2 milligram per kg per minute till your blood glucose level is more than 45, and then continue monitoring your blood glucose level every 6 hourly. When blood glucose level is more than 50 for last 24 hours, thereafter you can start decreasing GIR and start feed simultaneously. Start decreasing GIR at the rate of 2 milligram per kg per minute every 6 hourly, right? The other scenario is if even after repeating your um, GIR at the rate of 2 milligram per kg per minute every 30 minutes, in case if it reaches 12 milligram per kg per minute, but the blood glucose level is still less than 45 milligram per deciliter, it means that's a case of refractory hypoglycemia, which need to be evaluated, and a shot of hydrocortisone need to be given.